Well, thank you for joining us tonight. We had a really great session this afternoon with Angelica and Jennifer Bennett. And let me just brief introductions. Angelica is a 2017 graduate of University of Southern California with a master's in science in gerontology. So she knows academically what it's like to be old. She obviously hasn't experienced it yet but and also joining us is Jennifer Bennett. Jennifer has been with ROSA for 19 years, which apparently is an eternity in this industry to be around with somebody in this industry in the kind of role that she's been in. She has become a go-to resource for me whenever I have a client situation needing some care, needing some guidance, and so we came up with the idea of putting this presentation together several months ago, and I'm just so excited we've got that now. We are using Slido for Q&A, and if Rose can put the Slido up, all you have to do is take your camera, your smartphone, and point it at that QR code, or open up another window on your computer and go slido.com and enter the 992244, and that will get you into the session. We do have an active poll on that session. So Rose, if you want to pull that up so that people can get a feel for how this works. We do have an active poll there. There we go. So the poll questions are, what does DNR stand for? We can say it's definitely not Ralph. Well, half the world thinks that. Or do not resuscitate, or do not record, or is it the Democratic National Republic? Let's just show the correct answer, and we'll go from there. Okay, so DNR stands for do not resuscitate. So, Rose, you want to take us back to the presentation, and I'll turn this over to Angelica.
Yes, thank you so much. All right, let's go to the first slide. So we're going to take a big picture view of what's going on in the state of California when it accrues to older adults 60 and older. This map shows the percentage increase that we are going to see between the years of 2010 and 2060. This is a projection, and the important thing to note is that in the counties of San Bernardino and Riverside, there's going to be an over 200% change. Los Angeles is the orange color. That's going to see about a 150 to 199% change. And Ralph at our last meeting had asked me, why do we see this disbursement of people, and why is Northern California, more blue, and we're going to see less change? And so I did look at the physical map of California, and I do believe part of that has to do with the terrain in that area, and just, the different parks that are up there. And I just think it's less populated than, the southern part of our state. So we will see a lot of older adults. And this is important because it will impact us on an individual and a societal level. So it's important for us to be able to meet the needs of these older adults in these different communities because they are large and diverse. So now we will go to the next slide. So there are 3 stages of the aging journey. This kind of mirrors similar to what retirement planners use. The first stage is the go-go years. These are the post-employment years when they are in their retirement. Your older loved one is enjoying activities, they're traveling, they're doing all the things that they couldn't do when they were working, pursuing their hobbies and, living their life to the fullest. Then the second stage is the slow-go years, where we will see some changes, and we will see those changes related to your age. So you'll have more limitations, and you may see changes in your mobility, your vision, and that would happen in that second stage. The third stage.
So those limitations are due mostly to health issues, or are financial issues, or are they a combination?
Yeah, that's a great point. I think it has more so to do with just the pace of life. So as you enter that stage, you're just going to slow down. You may not travel as far. You may not feel as comfortable doing things like you were before. It may be harder to drive. Health related, you may need to be close to home for your doctor's appointments. So I think it's, also financially, maybe you already did what you wanted to before, and so you're going to take a different route. So I think,
I guess an appropriate way to measure that would be that, that if you're under 40 to qualify for the Boston Marathon, you got to run a 3-hour marathon, but to qualify at 65, it's almost a 4-hour time cutoff.
There you go.
So we do get slower but fortunately the competition, well, I guess as a competitor, fortunately the competition dies off.
And then, yes, we have the last stage, which is the no-go years. And that stage is the end of life. That is where there is typically further decline in your health and your mobility. And that does tend to be in the late 80s and onward.
I do expect to be running the Boston Marathon in my late 80s. So there you go.
Yes, there is a thing called successful aging. So yeah, there's people, in their 90s that do amazing things. So I think if we put our heads together, we can advocate for great aging for everybody. So yeah, it doesn't have to be that way necessarily.
And I think, Angelica, we've seen clients, where a typical caller would be calling for their parent who needs assistance at 88, 80, 89. I will tell you that in the last 2 years, I've received over 2 handfuls of clients who are over 100 years old. So, and I think our oldest client was 108 and was independent at 106. So,
wow,
I know, pretty awesome.
So just in the 20 years that you've been in business, you've seen what you're saying is you've seen an increase in the age when people start to need assistance.
Absolutely.
Yeah, that's cool. Very cool.
Definitely. Okay, so during the go-go years, this is a great time when your loved one is still experiencing complete independence, and you can work with them to proactively plan for their aging journey. As we mentioned, the 3 stages, there will be transitions among those stages from one to the other, and that can be difficult. So having a guideline to follow helps make the decision process easier, and it makes it more able that your family can support you during this time and you can support your loved one. So it's very important also to discuss their current support network, even though they're, still young and doing all those things on their own. It's very important to talk to them about who do they trust and who do they listen to. Kind of get to know their advisors or people that they go to help if it's not you. And then ensure that they have a good support system. And if they don't, then help them build one. Introduce them, to people in the community, connect them with other relatives that are nearby or friends. It's very important, even as we age, to have connections with different people, including people from church, professionals in the aging field, like life care managers, having a relationship with their doctor, any specialists, providers, nurses at the doctor's office, attorneys, and financial advisors. Those can all form part of your interdisciplinary team to support your older adults.
Another aspect of that is possibly, and we didn't talk about this before, but social and local social, fraternal and community organizations like Rotary and Kiwanis, the service clubs.
Knights of Columbus, I know some.
Well, and that would be on the fraternal side, the Knights of Columbus and the Elks and the Moose and Optimists and those clubs. Tend to be fraternal organizations. They're primarily social, but then there's also the service organizations like Kiwanis, Elk, the one I was in, Rotary, that are primarily service oriented. The Lions is the other one. Those are the big 3 in service organizations. So anyway, those would be good referrals and good places for people to go to connect, because now you got a useful purpose, an important purpose in the community, which is really good to be.
Absolutely.
And that's critical, even as we age, especially if you're transitioning from having a job to now no longer having one. You may need to connect with these groups in order to continue having that purpose, like you're mentioning, giving back what you do have. Especially
if you're like so many that as soon as they leave the workforce, they decide to leave the area too. Here in California, it's a huge issue.
Yes.
Because they sell their home and they have cash to buy a new home in Tennessee and enough to live off of between the proceeds of the sale and the whatever they have in retirement assets and Social Security but they moved to Tennessee, and who do they know?
Yeah,
nobody.
Gotta make new friends.
Tennessee, Texas.
So it's very important. Pre-planning not only helps you guys make decisions, but it also helps you avoid pitfalls. So tackling these difficult conversations early on allows for you to discuss openly exactly what your loved one wants. The conversation can also include their primary care physician as an additional support or a life care manager to answer specific questions and provide guidance about the aging process. There may be questions that you don't have answers for, but there's definitely professionals out there that can help and guide you. Some of the questions that you will want to ask your loved one is, what are their care or housing wishes? Would they be open to having caregivers in the home if they were to need some assistance? Would they consider moving? Is that something that they would like to do? So having these conversations early on can help you plan for their future aging journey and where they want to be at that stage in their life. It's also important to discuss who will handle the finances when your loved one can no longer do it. There are a form called the financial power of attorney that can be filled out, and your loved one can designate a responsible party to act on their behalf. There's also estate planning, which is very important, not only for designating where your things will go when you pass on, but as well as including information about what care and how to manage your finances if you're incapable of doing that before death. Having that plan in advance helps just ease the stress during that time. Your estate plan can also include instructions and arrangements for any long-term care insurance to help pay for your care in case of extended illness or injury, and life insurance if you want to include that for your family. Estate planning can also help minimize taxes and court costs. It's very important when you are going through the process of estate planning to know that it's ongoing. It's not a one-time event, and you should review and update your plan as your family and your financial circumstances change over your lifetime. So this is something that even though you discuss it early on with your family, it's always good to revisit, every year or every 2 years to make sure everything is still accurate. Very important. You'd also want to ask them about their end of life wishes and what they want for their treatment. In order to have this documented, you can complete a living will, or there's also a document called the 5 wishes, which is very straightforward and just asks a couple questions. And that is also a document that you can provide in the state of California. There's also advanced healthcare directives that can be completed, and those can be submitted to hospitals, your doctors. That way they also know your loved one's wishes. Without these documents, it's likely that some decisions might be made without their input or may go against what they actually wanted. Another form, like we mentioned earlier, is the DNR, or the Do Not Resuscitate. So this is an order that basically tells paramedics or anybody providing any medical treatment what exactly it is you want. Typically, this form is kept in a very visible place, sometimes on the fridge, somewhere where you can easily access that form, because without it, then those wishes would not be fulfilled. So it's very important for these documents to be kept in a readily available location where you know exactly where it's at when you need it, so you can provide it to the responders. That's very important. That's one of the questions I ask.
I guess you could get it tattooed on your chest, right?
There you go. But yeah, it's very important because it's a document that outlines your wishes. So we always want to make sure that if it's something that's present in the home, that we also have a copy. So very important. There's also the physician's orders for life-sustaining treatment or a pulse. And then finally, when we're talking about end of life, we also want to have the discussion about any funeral or burial arrangements. You want to ask if they've already done this or if they need to arrange that. That will just help with, again, making those decisions last minute and possibly also not being able to afford that. So it's very important if we plan early on for our death that we also include our funeral or burial arrangements in order to just help our family. So another important aspect is emergency preparedness. It's very important to have a plan in place when a crisis or medical emergency does occur. This plan should include who in the family is going to do what, or who can respond the soonest, as well as any other caregivers that are involved with the older adults. It's important to keep a current contact list of all these people that are involved, as well as any medical providers overseeing the treatment. You want to make sure you inform your team of any changes in your loved one's condition. That way they can make sure that they also follow up with any treatment. It's also important to have copies of their health insurance cards. That's something that's typically asked for in these situations, and having that documentation ready will just make it easier for you. You can also, in advance, complete a healthcare power of attorney or a release of information. Due to HIPAA, a lot of organizations, especially medical providers, won't share information unless these forms are completed. Even if you're a loved one and your daughter and you're concerned, they may not want to allow you to be involved. So if you do the legwork early on and complete these forms, then you're able to advocate for your loved one when they cannot. Also, it's important to have a current medication list to include any medication allergies in case that is something that is a concern. And then sometimes people do have a preferred hospital in their community that they would want to go to. So it's good to also have that documented. If you don't want to go to a specific one, where would you like them to take you? And then finally, I do want to say that prevention is also a part of preparing for emergencies. So looking at ways or strategies where we can implement a support system or a safety net for concerns that we might have. Some solutions may include medical alert devices that allow you for a peace of mind. As long as your loved one knows how to use it and when to use it, it's a great support system in order for them to remain independent.
And these, I'm sorry.
Go ahead, Jennifer.
No, just about the medical alert device. They've really come a long way. Now they have these devices. If a client falls, they have a fall detector. The client doesn't even have to push the button. So if there is some mild cognitive impairment and maybe they don't remember to push the button, that device is prompted just, because again, there's a fall alert in it. So we've seen it come a long way over the years. And a lot of what Angelica is sharing is really to also prevent crisis, meaning that frantic call. Yes, we can never plan for a total, there's going to be emergencies and we can't get around that at times, but it's the crisis. It's that frantic, what do we do now, and scrambling last minute. So go ahead, Ralph. Sorry.
Yeah, well, actually, you teed up the question that's in the queue right now. It says, my dad has had a long-term care policy for 30 years, but he won't discuss the possibility of using it. He's 85 and lives alone. And what can I do? So, we talked about getting this information. I think this goes to the question of having that dialogue with dad. He won't talk about it. So how do you open that conversation? How do you get that started?
Yeah, I would say we encounter this, there's resistance or there's maybe just minimizing of what's going on. So I think in order to get to that conversation, you might have to take some baby steps. So opening up the conversation in other ways where you're asking your dad, if he needs help in any areas, trying to align with problems that he wants to be fixed. Saying, oh, that looks really hard for you. Would you be open to that? Or have you ever thought of this? I think, giving him the option to express what he thinks is a problem and then, offering a solution for that might work. And then opening up the conversation to let's discuss this policy. Or you can even say, I was at this presentation and I think, you can benefit from using your policy, and just sharing information about the benefits of it could convince him. But I think, it's very common for people to be resistive or not want to admit that they need help.
As we're talking, I'm thinking about my own dad, who's 89 and has commented about all the people, all the family, all of the friends that he's had over the years have passed away. And each time one of those friends has passed away, it's actually opened up an opportunity for me to say, your time is coming, or when Roland passed, well, he got Alzheimer's. And so we had to deal with that as his best friend. But ultimately he passed. And that opened up the opportunity for us to have a conversation and with, where is your stuff? What do we have? And we pretty well know. But so I think that the experiences that they are going through with their friends dying and getting sick or going into nursing homes or whatever it may be. Each time that you're aware of something happening, it's an opportunity to say, well, hey, if this were you, if it was you and it was going in, how would you want me to handle that? So that you're putting it in a context that they can relate to. But even that goes back to the key element of having that communication on a regular basis and having and getting that line of communications open. There's another aspect to this that I think is important. And we're going to get to long-term care in a minute, but since we're dealing with this 30-year policy, Jennifer, 30-year-old policy, what is it likely? Because apparently this person does not know. He knows that there's a policy being enforced for 30 years, but what's that likely to be? What describe that policy?
Yeah, it's typically an older policy that has a use it or lose it, what we like to call use it or lose it, that if you don't act on that policy when the time is right, you may never get benefit. There's not a death benefit rider. In the newer policies, there's a life insurance built into it, right? Where if you don't use that policy, it's really more like a life insurance. But typically it's a use it or lose it. And I've shared in the past that I've had clients who have waited too long. I remember a gentleman in Orange County who literally only benefited from 5 days of that policy because there was a 90-day elimination. He was on service with us for 95 days. Then unfortunately he passed. He could have really used his policy 2 years prior. You know, most policies you only have to qualify with 3 activities of daily living. And I wanted to share, there's sometimes a misconception. You know, you buy a policy 30 years ago and you remember when the time and I need somebody to bathe me and dress me and feed me, but it's not really like that. They just need assistance with some of those activities of daily living. So I think it's really important, like whoever posed that question, to really tap into that policy, try to have some more conversation, because there might be a misconception of, well, I'm not there yet. I don't need it. I can bathe myself. I can feed myself. But it's just the assistance that can actually activate that policy.
And Jennifer, is it correct that once you start using the policy, you no longer have to pay the premium?
Correct. That's correct. Yeah.
You could mention that.
And you could mention that as, you know, think about it. It exactly, that they would benefit that way. You know, you no longer have to pay the premium. And yeah, so that's a good point, Angelica. That definitely might be a position that one could take with regards to getting that policy going.
And we're going to get to the cost of different benefits and different levels of care later on in this presentation. But I think it's important, while we're talking about the policy itself, is that policy is typically a bucket of money. And it may be that you only need $1,000 a week or $1,000 a month care in the sense that you just need somebody to come in several times a week to help with the activities of daily living, as opposed to the other extreme, which is you're in a skilled nursing or memory facility where you got 24/7 care, and that's obviously a lot more expensive. But you have a bucket of money that can apply across the gamut of those issues. So I think
I think preventing it, right, Ralph? I mean, that's such a good point that you bring up. If you start using your policy, you can prevent. I mean, the goal is to prevent the fall, to stay healthy, to get the proper nutrition, socialization, and that goes a long way. And so, right, before somebody would have to go into a facility, a long-term skilled or memory community or assisted living, you can do a lot to prevent that. And it may be able to stay in your home a lot longer if that's the overall wish.
Yep. Excellent. Good deal. There's another question here, and you used the term elimination period. Jennifer, do you want to explain what an elimination period is?
Yeah, so it's similar to a deductible, right? I think we kind of covered that verbiage in our previous presentation. So there would be 90 days, and it's really good to look at your policy again to find out, is it 90 days straight, or is that calendar days, or is it 90 care days? Right? Because I've seen policies written both ways where they have to actually have 90 care days, and then that elimination period is met, versus 90 calendar days at that, you know, so make sure you look at that in depth in your policy. And then once you meet that elimination, that deductible, then basically you would start getting reimbursed from your long-term care company. You would always pay the home care or the assisted living upfront, and then that reimbursement would start.
Got it.
That's pretty typical.
Good deal. Great. Well, let's go on to the next.
Yes. So it's important also, as we're discussing these transition and changes, to also plan for changes in care and housing needs. So we're going to discuss some care and housing options. The first one is aging in place. So it just means that most of us want to stay in our home for as long as possible as we age, and even as we transition through these stages. It's very important with this option to have the right support. That means making sure that the home is safe and accessible. One way to do this is to team up with a life care manager to have a home safety eval. You can come in and they can give you recommendations in terms of what things are needed to make the home more suitable for your loved one. Some of the common things that I've seen in homes would be, in 2-story homes, a chair lift. I also have seen remodeling bathrooms to have walk-in showers that are more accessible, installing grab bars and ramps. Things like that are necessary to be considered in order for your loved one to continue aging safely in their home. Additionally, home care can be brought in. So like we mentioned, you can use a long-term care policy for care in your home. Home-based options can typically, for policies, it's private, going through a company. So you hire, like Jennifer Bennett mentioned, you hire a company, they provide the services, and then your long-term care company reimburses you If you don't have long-term care, then the cost for that private caregiver through an agency is out of pocket. Of course, if you do have family or friends that can pitch in, that's also another option when you're aging in place.
And I just want to touch a little bit more on that, and the importance of using a licensed and bonded organization. Keep in mind that when you don't use an organization and you may hire privately, like the neighbor or the gardener's wife or whoever might be in a circle, that you then take on the liability as an employer. So I just want to mention that. I think it's really important because one may not think of that. They just may think of more like a babysitter, where you're having somebody come in and watch your child. And it's different. It's definitely different with regards to home care. So you don't want to be liable as the employer for hours and wages. So I just wanted to touch on that a bit.
Thank you.
It's also a little bit of a protection when you're hiring an organization that's bonded. There's also an elder abuse protection level there that comes into play. In most cases, when elders are abused, there's a sense of isolation. Isolation is one of the key indicators of an abuse situation. When you're hiring an organization, that's less likely to happen because the caregivers rotate. But if you have one person that then can isolate mom or dad from the rest of the family, from the rest of the world, that just opens the door for an abusive situation. And so abusive, physical, it can be physical, financial, it can be emotional, but in any case, it's just another aspect of that. So
absolutely,
definitely. There's also independent living communities. Those are typically active communities for 55 and older. They do offer different types of housing, and typically they also have units that are individual, like little homes that older adults will live in. In these communities, they offer services a la carte. So that just means that whatever that person needs, they can pick and choose how much services they want. If they just need someone to come in, twice a week to help them with certain aspects of their care, they can select that. If they need more care, they can also pay for that. So independent living communities still offer some services, but they're mostly geared towards active adults. They have very robust activities. They have groups. They have, everything that you would want to do. They can offer that as well. So it's a great opportunity to connect with, older adults your age and also remain active. The next one is a board and care. That is a residential setting. That is 24-hour care. I've seen ones that are on the smaller side with a few bedrooms up to, 6 bedrooms. So it really depends on, each one is different. Each one is run by a different person. So it's really important if you are interested in board and cares, to visit them, to get to know the ones around in your community, as well as the staff. You want to make sure you have a good connection with the staff at the board and care. That also applies for any senior living community. Get to know the staff, who works there, how do they treat each other. That's also really critical in the decision-making process of where you want to live.
And Angelica, I think with regards to board and care, I think that's probably the least thought of out of the list, but it's actually a very good alternative when a senior is used to being in their home and receiving one-on-one caregiving. And maybe that senior gets to a space where it is 24/7 and the cost becomes just too much, right? That boarding care is going to give you that one-on-one care where, as you go on, I know to talk about assisted in memory, that's not necessarily the case. So I think transition from, again, a client having one-on-one home care to boarding care is pretty similar. So
right. Yeah, boarding cares are just like homes, but they've brought in, staff. They are regulated, they are licensed, but they're very residential. So yeah, you're walking into a home where people live and get the care they need. Yeah, they're really, some of them are really nice. So assisted living communities, those are typically those, big buildings that you see. They're mostly apartments that are where you can live. The apartments usually have like a small sink, a microwave. It's definitely it's not meant for them to cook in. It's just meant for them to, have simple meals, prepare simple foods. They do range in size and cost. So it's definitely looking within your own backyard on those specific numbers. But assisted living communities are great. If you're past the stage where you're not that independent, you can go to assisted living and have your meals. You can have caregivers check on you on a daily basis, but the caregivers are not one-on-one. So they typically, work with up to 20 patients in one day, where they're going, from one to the next. So it is less personal in that way, but they still do provide those services as far as helping with your activities of daily living, transferring, things like that. They do that, but they may take a while to respond. That's been my experience lately too, that, you know, the care isn't always there right away, but they do come, but you just sometimes have to wait. So assisted living communities, that would be one of the drawbacks, definitely. But they have the meals, the activities, as well as the staff supervision that's there 24/7. So it's a good option if you find a good one. And likewise, there's memory care communities. So these are secured units, usually also part of an assisted living building. Typically, they're also part of that. And they're also apartments. I've seen most of them have shared apartments where it's 2 bedrooms and they share the bathroom. There are some private ones, but typically it's a shared situation. Same thing, size and cost varies. But the important thing with the memory care is that there is 24/7 staff supervision and monitoring, and that is geared more towards people who have cognitive deficits and need that type of level of support. It also includes the meals, activities, and medication administration that would be included as part of memory care. Then there's also continuing care retirement communities, or CCRCs. These communities typically require a substantial buy-in. Some of the newer ones that I've come across have asked for about $300,000 up front. You put that money in, and then you pay a certain monthly fee for your living expenses there. Typically, when people move in, they start in the independent living, but the continuing care retirement community does offer all levels of care. So they have independent, they have assisted living, they have memory care, and they also have skilled care. So people, you know, that do buy into that feel like that's a kind of a health insurance policy for them. Like they're going to get the care for the rest of their life. And so that's also another option if you're interested in that. I think those are really great. All of them are different, like anything else. So it's always good to, you know, visit a few, check them out, get to know them, attend some activities, and see if you could really, your loved one can, you know, live there. And then the last one is the highest level of care, which is long-term skilled nursing facilities. These are 24/7 care, nursing care, where you have a nurse on staff, there's supervision, they are also secured. And oftentimes the rooms are shared. So I've seen up to 3 beds in one room, but services are provided that are skilled, like OT, physical therapy. OT is occupational therapy, speech therapy. Those are all provided on site. So these are typically places where you might go to rehabilitate after being discharged from the hospital, and then you go home, or sometimes you do get placed long-term there, and you know that becomes your home.
So, you know, all these options that you've described imply, with the exception of aging in place or home care, imply that you've got money to spend on the care. And we have a question in the queue that is, you know, what about a loved one that has nothing in place and no funds for care? My family is trying to figure out how to care for my mom while we're still working.
Yeah, definitely. We do see that as well. And so, yeah, there are certain, depending on where you are, if you're in California, if you're a low income senior, you can qualify for like supplemental security income, which you do get a small paycheck every month. You can also qualify for Medi-Cal if you're low income. You may be able to get her food stamps. So it's really important to connect to those social services that California offers, especially for low-income seniors. There's also something called an assisted living waiver program, where people on Medi-Cal will be placed at assisted living facilities if they meet that level of care. And that program was really created as an alternative to nursing homes. They want people to be in an assisted living rather than a nursing home because of the cost. But basically, that's another program where there are long wait lists like anything else. You know, all of those programs, there's more demand than supply, unfortunately, but that might be another way to secure care and housing and have it subsidized. So there's different programs. So you definitely can research in terms of where you're at and what your state offers. So those are some ideas that just come to the top of my head that I have worked with. So definitely there's options out there. So as Ross mentioned, there is a cost, and this slide just basically gives us an overview of, for the Los Angeles area, this is 2020 numbers. And so we're looking at monthly costs. So for homemaker services, they're projecting if you're getting care or services for 44 hours a week over a 12-month period, that would cost you $5,434. Homemaker health aid services for 44 hours a week over a 12-month period would be $5,529. So yeah, if you're low income or you don't have a long-term care policy or you don't have $5,000 of excess cash anywhere to pay for this, then yeah, looking at other options is definitely smart and highly encouraged. Adult day healthcare centers can also be another alternative that's more affordable. These programs are typically half-day programs, and they provide transportation, a lunch. Sometimes they have nurses on staff to help with medications. They do exercises, so they create care plans. I've actually worked at two. So they're really great places in your community if your older adult likes to be around people and needs to be somewhere during the day. And if they do have Medi-Cal will pay for them to go, which is really great. So you wouldn't have an out-of-pocket cost in that respect. Assisted living facilities for a private one-bedroom would be $5,000 a month. So again, the cost, like Ralph said, is very high for care in terms of these numbers. And nursing home care, which is the highest level for a semi-private room, is $8,060 a month over a 12-year period. And a private room would be $10,570 a month. So as we go up in care needs, the price will also go up. One thing I forgot to mention too is that some of these assisted living facilities will offer tiers of care. So depending on how much you need, that also increases your cost. If you need types of medication, if it's every, as much work as they do, they end up billing you for that ultimately. So it's good to know.
And I want to touch on the home care side because, again, not to date myself, but we used to have a live-in. Most home care companies could provide a live-in rate. And I still get calls where the adult children or responsible party will say, well, we just need a live-in. My loved one just needs some care during the day and just needs somebody there in the middle of the night in case they need assistance up and down to the restroom or they get anxious at night. But that really was taken off of the table about 8 or 9 years ago. And now home care is billed hourly. So just to put it into perspective, when a client needed 24/7 care years ago, it might be about $7,500, $8,000 a month for 24/7. It's now gone up to about $18,000 a month to stay in the home with 24/7 care. And that's a rough number, anywhere from 18 to 20. But I share that because it's definitely changed. And we're going to continue to see changes. So I just wanted to touch on that.
Is that a change? Correct me if I'm wrong, but that's something that was instituted by a legislative change in Sacramento, correct?
Absolutely. It wasn't the home care companies didn't get together and say, let's do this. We were actually fighting against it just because really there was no benefit for the client. A client couldn't afford it. And even the employees, the caregivers, they benefited from doing a live-in case, if you will. There was downtime, but you're right. It was a labor law.
And is that something that's run across the country now, or do you not know?
That's a good question, Ralph. I do know that is California. I'm not sure about the other states, but I can find out that answer.
It'd be interesting to find out because the idea of having a live-in, for all the reasons you just described, makes a whole lot of sense, and yet sometimes the politicians think they know better.
Right. And think about think about those clients who planned on that figure, right? That $8,000 a month roughly for a live-in, and even bought policies that would justify that. And literally in a matter of, that bill passing, that just was taken off the table. So we did see a lot of seniors moving into communities when that legislation passed.
Yeah. Interesting. Let's move on to the next slide.
Now we're going to discuss some signals or things that you should monitor in your loved ones. You should watch for changes in their grooming habits, pay close attention to their personal hygiene and appearance. If you start noticing that they may be wearing the same clothes over again, or their hair might not be washed, that might be an indication that those tasks are more challenging for them. They may not, or they may be forgetting to do those things. So it's very important to cue into these things, as well as their home environment. When you visit, you want to pay attention. Are they keeping up with their household chores like they used to? Do they have expired food in their refrigerator? Is the mail piling up? Those are signs that something might be, causing that. There might be an underlying cause to that. So it's good to explore. It's also another signal would be memory loss. And this wouldn't just be, I forgot where I put my phone. This would be more so not remembering familiar places or faces, also missing appointments due to not being able to manage their calendar, And sometimes, typically with memory loss, there's also confusion. So you may notice they may be more confused and just might not be able to follow along like they used to. That would be a signal, and that's not a normal part of aging. So having that assessed is very important, so you can get support for them if needed. A caregiver, or like we mentioned, an alert bracelet, things like that can be implemented early on so that they can remain as independent as possible. Weight loss could be another signal. Typically, I like to say that, if somebody's, when I see this, I do concern about people's depression, possibly their mood. As our loved ones get older, like Ralph mentioned, there's more losses, their, connections are shrinking, they're having these other changes. So it's very important. Sometimes that can lead to poor appetite. So having enough protein, even when we're older, is very important for our health. So making sure they're getting the right supplements and nutrition is important. And maybe it's harder for them to cook, so they're not eating like they used to. So, or, they're eating foods that are not healthy for them. So it's really important to kind of figure out what's going on if you notice that change. As I mentioned, mood changes. So making sure that their mental health is taken care of, that you're checking in with them about these losses or about their decline in health, and then addressing those concerns with their doctor, discussing, what can be done to help them. Because again, that's, we all have mental health challenges. And even as we get older, that's something that needs to be addressed. It shouldn't be just left alone. Any changes in their social life. So are they meeting less with their friends because they don't want to go out anymore? Are they starting to withdraw socially? Are they spending more time alone? So those are different things that we look out. Are they disconnecting from their friends and family? Are they not as calling you as often? So this is very important because this could lead to feelings of isolation and loneliness. Are they having frequent falls? So addressing what could be the cause of this, either medical or environmental, and monitoring them as much as possible in this regard. Falls can be deadly and they can lead to hospitalization. So we want to make sure that if there's, a rug that needs to be moved, or that if there's something that needs to be addressed, that it is. Definitely, you want to notice their financial spending. Are they changing their behaviors when they're spending money? Are they giving more money to charities? Are they not paying their bills and running behind? Are they not able to manage their checkbook like they used to? Also, another signal would be, are they misplacing money? Are they not remembering where they put that, money, and then they're getting more money out and, misplacing that. So that could be another sign that they're not able to financially manage themselves. Unsafe driving is another signal. So making sure that we're addressing any accidents or concerns with their vision or their cognitive state.
So I think that's important. That's good points that Angelica was kind of going through, but it's also really important to know that when you may come across one of these bullet points with a loved one or a client, not to necessarily panic either. In the years I've done this, I've gotten calls from the adult children or the professional that, I think my mom or dad may have Parkinson's or had a stroke, or early onset of dementia. They're mumbling their words, and actually it was a urinary tract infection. So I share that, not to say that obviously, if we're seeing a pattern, it is cause for concern for sure, but also, dig a little bit deeper, pull back those layers of the onion, discover what could be causing it. Again, a urinary tract infection for seniors can really do a doozy, and it does mimic often. It could be like a stroke, a TIA. So I just share that because as again, you see the exclamation point, it is a cause for concern, but let's peel back the layers of the onion to determine what truly the diagnosis is.
Definitely. Yes. Thank you so much. And just, are they still able to manage their medication? So making sure that they're taking them as prescribed, they're not missing dosages or over medicating. That's also a concern and can lead to other health problems or emergencies. So it's really important to just check in on these signals and dig deeper, like Jennifer mentioned.
So, Angelica, we have a question here. And has COVID impacted our seniors by making all of these things that we've listed here even harder to deal with?
Yeah, I would say that COVID has definitely made it more complex and, really made it harder for families to reach out or to be involved, to visit them. I know, facilities weren't allowing people to come in.
Absolutely. So tips for stepping in kind of goes back to a few slides prior. The more we can communicate on a regular basis with our loved ones or our aging clients, the more likely they are to share with us and express their feelings and their needs and concerns. Promote home safety. Absolutely. Make some small modifications. Maybe there's some dishes that are set way too high in the kitchen that can just be moved down a couple of shelves. Maybe that loose rug or mat, near the bathroom could be a fall risk, a fall concern. Loose cord. So do a safety eval of the home when you're visiting. I think that's important. Promoting health and exercise. Lean on the community. Now, again, different climate because of the pandemic, but typically there are some good programs at your local senior center. Go for walks with a loved one, or maybe even get them involved in a walking club. I know, Ralph, you're a runner, so I'm preaching to the choir here, but that's always super helpful. Promoting socialization, we kind of talked about some organizations that are local in the community that one could join, and then establish a support network. That's always important. Sometimes you may have to lean on your financial advisor, your estate planning attorney to create that network, but definitely I think that establishing that support network early on is a great value.
Absolutely. Very good.
Thank you. Okay, so the SLOGO years, we will discuss some of the signs. And so it's important to note that at this time, again, we're noticing a transition from the GO-GO to the SLOGO. And so we may see challenges with their mobility, their vision, hearing, or their self-care, as we've already mentioned before. Household activity might change. And so that, again, is just a sign that they may require more assistance. Whether or not they're willing to accept that will be a challenge in some cases. But I think there's, enough support out there with professionals in order to address, that resistance. There's different things that can be done in order to basically gain their trust in the plan, right? We're setting up this plan and we want them to go along with it, but they may be unsure, mostly because, they don't want to admit that they're having these difficulties. So it's really important that we're there, or that we're present, like Ralph said, at the beginning when they're doing well, and that we're talking to them about these things and what they think about them. It's interesting because it says the likelihood of a 65-year-old will need some form of care is 70%. So we can, kind of guarantee that there's going to be something at some point when we're older that we're going to need help with. And that's going to be, that will vary based on every individual. And like we discussed, preference is to remain in their home for as long as possible. So even as these seniors decline, that doesn't mean that they're ready to go. That doesn't mean that they want to give up, their home or what they've been doing. So it's kind of just adjusting with them as they go. That's very important, meeting them where they're at and making small changes to help them through that transition. And then the last point is that no matter what age we are, we all have a strong desire to remain independent and in control of our lives. Even if things are difficult for them, they still want to do as much as they can for themselves. And there's different ways to facilitate that and still have them feel like they're participating in their care and their plan. I think, respecting their autonomy and making sure that they're involved is really key at this stage as well. You can go to the next slide.
Preserving family dynamic and establishing healthy boundaries. And most of the slides that we've spoke about, talk about the health and the physical and the expectation. But I think that part of this conversation we're having about planning really leans in on preserving a healthy, good, happy family dynamic. So the more that we have these conversations, choosing wisely which child you want to be the power of attorney over health and finance, and really explaining why that child is handling the health and the other handling the finance, and really creating that internal team with your family is so important. Early planning reduces the burden on family members also to make decisions without any input from the older adult themselves, and involve trusted professionals to provide objective recommendations and guidance. So the more, again, conversations we can have early on, the better. Ralph, I actually have want to pose a question to you. Have you seen this as well, from a financial planning standpoint, where, who's making the decisions, which child gets that privilege, if you will, which it really sometimes isn't a privilege?
Oh, absolutely. Absolutely. We've, of course, it goes round and round. And I've had a few cases where I was able to initiate some estate planning work early on. And I've been around long enough to see it come full circle. And because we knew what the situations were, the next generation was involved in those in the scenarios. And it was a lot smoother than the cases where somebody, up and died and we had never met or talked with the next generation.
Right.
Or somebody got sick, and next thing we know, we're getting phone calls from a child that is taking control of a situation but was never part of it. It's always better when those relationships, the family dynamics are in place, than the situations where, for example, early on, a client, and I alluded to this earlier, retired from the El Segundo area of the refinery in El Segundo, and up and moved to Myrtle Beach, which is a golf community, and he was a golfer, and but didn't know anybody, got swindled out of most of his money, and came back and moved back to Phoenix area, which was closer, where he, and ultimately he passed, and the wife lived about 20 years longer. But ultimately, one of the three kids wound up taking care of mom, and that worked out in the end. But it was very difficult because he was estranged from his kids,
right?
And where they were,
yeah, it's real life. It is absolutely
Right.
real life, and it is so common. And how many calls have we received where one sibling is doing more and the other sibling isn't doing anything to help? And so yeah, the more conversation, the better, and determining the roles early on and why those roles have been designated to the children or grandchildren as such.
The other thing that I'd like to point out is that when there is any kind of money involved, if there's any wealth at all, oftentimes the kids aren't the problem. It's the in-laws that become the problem. The kids, the wife, the spouses of the kids, because they don't really have that attachment to their in-laws, and they perhaps want to, it's like, okay, I can't wait. Why don't they sell that? Why don't they sell that building so I can get my money, my share of the inheritance out of it? And that can create some real stresses and tensions for the family and for the individuals, and cause them to make decisions if they don't have the paperwork in place, and if they don't have the guidelines in place. What's going to happen if they have the guidelines in place? Is what's going to happen. It becomes a lot easier to defend the executor's decisions, and that becomes important.
Good point. Absolutely. Very good point. I have a neighbor going through that right now, and it is a nightmare. And sometimes, it's not a gift to necessarily be the trustee or executor, right? And that it's really not. It's a thankless job. And so, yeah.
Yep. You can't win. I know one situation where the three siblings lived in a disparate part of the country. All three of them. One of the siblings lived nearby and provided all the care. But the patriarch set up his estate plan so that even though that person was the executor, the co-executor was the guy's accountant.
Oh.
So now the accountant has to sign off on everything, which means that now you've got a third-party accountability to vent, if you will, vent any frustrations for the outsiders. So the people on the outside that aren't there all the time, that can't be there because of the logistics, can at least there's a third party, which has a certain level of fiduciary responsibility as a CPA, to make sure that things are divided up equitably, which is in this particular case, everything was divided equally. So we'll see how that turns out when it's all said and done.
Sure.
Definitely.
As long as the accountant stays in business until the patriarch passes, they'll be in good shape.
That's such a good point. Let's touch on that, because talk about continuing to update your estate plan. Sometimes the client lives longer than the estate planning attorney or the trustee, right? Or who's been named the trustee or executor. So yeah, it's so good to update that.
You have to keep in touch with it and have to stay on top of it. Mm-hmm. It's really helpful to make good connections. We've got several where it's the grandchild that is actually the trusted contact and has become the executor of the estate, because the grandchild is the one that they've had the closest relationship with, or the grandchild is the most responsible.
Right.
Yes. So we will touch a little bit on Medicare. So Medicare is a federal health insurance for anyone 65 and older. It's not income-based, it's age-based. And some people under 65 with certain disabilities or conditions can also qualify. So I'm just going to talk about the three parts. Part A, which is just your hospital insurance. So that covers inpatient care in hospitals if you're hospitalized. That also covers some skilled nursing facility care, hospice care, and home health care. Part B is your medical insurance. So that covers services from your doctors and other healthcare providers, any outpatient care you receive, also home health care, and some durable medical equipment, as well as preventative services, which are considered screenings, shots or vaccines, and yearly wellness visits are also covered as part of Part B. And Part D is prescription drug coverage. So I want to ask, if anybody can see what's missing here or what we've kind of spent at length talking in terms of
we've been
services.
talking at length about long-term care, and Medicare doesn't cover it.
Exactly. Yes.
I knew the answer.
Ding, 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 ding.
Yeah.
I knew the answer.
Medicare, it doesn't.
And by the way, I want to put a plug in for our replays. We did a full Medicare program just like this probably about a year ago. And it is on our replay list on enduringwealth.com under the events tab. So there's a full replay on Medicare. We have one on Social Security and we have one on long-term care. So the actual insurance and how to provide for it. So this fits really nicely with it. So
and please remember that you have the right as a patient to choose whatever hospice company or home health company. Yes, your doctor has to write the order, and there obviously has to be a need, or when you are transitioning to hospice. But if you're not satisfied with the company that the doctors set up for you, please know that you have the right to choose your own hospice and home health. And often patients don't know that, and they're not necessarily getting great service. So it's really important to know it is your option.
Great.
Yeah. Next slide, please. Okay, and now we've reached the end of our journey. So we're going to talk a little bit about a good death. So it's very important if we want to successfully transition through the different stages and into the no-go years, that we have all this planning in place. And it's important that we also discuss the supports that are needed at this time. So at the end of life, typically care is needed for medication management in order to make sure that all the medications are being prescribed accurately and given and dispensed. It's also important for families to be aware of the emotional and physical draining of going through this process with your loved one, and also consider respite care. Even if you're just going to do, a couple hours on the weekends or nights, you're doing the day shift and you need somebody at night, it's very important for caregivers to still be aware of their self-care. And sometimes even there have been cases where the caregiver will pass before the client. So caregiving is such an important job, but it's also a very heavy burden sometimes. So if we're not able to balance that out, bad things can also happen for the caregiver. So respite is highly encouraged at this time. Also, just having that care coordination, like we mentioned, you have Medicare, you need this service, you need another service. You'll be dealing with a lot of different providers. And so you can work with a life care manager to find what the good referrals are, or to help you communicate with them so everything gets done in a timely manner for your loved one. And that leads to advocacy. So it's even at the end of life, we're still advocating for the needs of the person. And it's really great when we have that plan already, when we've discussed what they would like, and then you're in a position to advocate exactly, what they want. You don't have to doubt yourself, and you feel confident that you're following their wishes in terms of that. And I think also working with a life care manager is helpful for families. I've done assessments before where the family, it was their father and he was on hospice and they needed care, and I came in and I did the assessment. And I also discussed what happens, what are the steps after someone passes away and you call hospice. So I was able to give them more information so then they would know what to expect. So I think we can all agree that when we know what to anticipate or we know how things will go, we have less stress and anxiety, and we can, go through that journey with less of those feelings. And so I think it's really important, to reach out if you're in this stage and, see what's available in your community and what professionals can help you.
Angelica, and also to maybe touch on hospice, it's a good thing. And I mean, what I mean by that is it really is a lovely service that a lot of clients can benefit from. And sometimes clients wait a little too long to get onto hospice. And they can actually greatly benefit because there is some respite that is built in often to most hospice companies where they can provide some caregiving. There's clergy support. And they also have a social worker that will be the liaison for the family. So, and I've had clients graduate from hospice because you do have to qualify. So every 6 months, you do have to re-qualify for hospice. So that's just something to note that, you know, it can be a very lovely service.
Absolutely.
What does graduate from hospice mean?
Well, I've had a client who maybe a diagnosis, and at the time they were hospitalized or had a change of condition. The expectation of living beyond 6 months was not going to happen, but they ended up living past 6 months and they lived longer and they no longer qualified for hospice. So they graduated from it and went down to home health where a nurse would come and take vitals and some physical therapy was given. So it doesn't necessarily mean you're going to pass because you're on hospice, but you do get benefits like a hospital bed and again, some caregiving respite and clergy and more support in the home. But it doesn't necessarily mean that you're going to pass. So I have had clients graduate.
But there is the expectation, and I was an impression that the expectation is that it looks like you've got six months or less or fewer to live, and that's a criterion for getting onto hospice, correct?
Correct, and you just have to maintain. Correct, and so you would have to re-qualify if you were going to be on it beyond 6 months.
Okay.
And, yeah.
And some people do, like some of our clients do remain on hospice for, a long term because they just get, reevaluated and they still need the service. So yeah, that happens too.
Okay, great. Good deal. Was this our last slide?
Yes.
Okay, so that's the presentation. Thank you, everybody. We had a couple of nice comments in the Q&A. Thank you. It's very helpful information, great information. Thanks. I want to remind everybody that we are on social media. You can follow us on LinkedIn, Twitter, Facebook, and every Thursday morning about 7:30, we post a vlog on those channels. Of course, we'd appreciate any kind of sharing and leverage you can put on that. We do have a couple more events coming up. We do a Zoom open hour about once a month. You can always find them at enduringwealth.com/events. Thursday, January 13th at 2 and 6. We always try to do them at 2 and 6 Pacific because we do have a client base in the East Coast that allows them to join us at 5 or 9 and everything in between. But we'll be doing a capital markets update after the first of the year, January 13th, with the title, Where Are We? Basically taking a look at where we are in the capital markets. That would be the stock market, the bond market, and the other aspects of financial that we deal with so well here at Enduring Wealth Advisors. And then coming up in February, we got one that I think is going to be really interesting, Growing Patience. We have a master gardener. Louise Sloan is a master gardener. And she is going to, apparently February, we talked about doing this thing with Louise, at least 6 months ago. And she says the best time to do this is in February, because that's when you got to plan your garden if you want to have a successful garden. So, that's what we're going to do. We're going to talk about gardening and on Thursday, February 10th at 2 and 6. So love to have you join us then. You can always check us out on enduringwealth.com or get on our distribution list, and we send out information from time to time, or follow us on those social media. So thank you all for joining us.